Hey there. I know that getting a new diagnosis can be a lot to take in, so we're going to walk through this together, step by step. If you've just been told you have something called retinal vein occlusion, or RVO, this guide is for you. Our goal is to give you some clarity and help you feel confident about what's next.
So you've got the diagnosis, but what does that really mean for you, for your vision, for your day-to-day life? And what are the next steps to get you back on track? Let's dive in and answer those questions right now. All right, first things first, let's get a really clear picture of what's actually happening inside your eye. Because, understanding the what is the best foundation for everything that comes after.
Okay, so what is this really? It's actually pretty straightforward. Imagine the tiny veins in your retina are like little streams. Well, an RVO is basically a little traffic jam, a blockage in one of those streams. And that blockage stops blood from draining the way it should, which can cause some leaking and swelling back there.
Now, your doctor probably told you if you have central RVO or branch RVO. Think of it this way. A central RVO is like a jam on the main highway leaving town, so it affects more traffic. A branch RVO is more like a closure on a smaller side street. It just helps us know exactly where that little traffic jam is located.
So if you're noticing blurry vision or things look a little wavy, it's all because of that blockage we just talked about. That leakage causes fluid to build up in the most important part of your retina, the macula. And that swelling, which doctors call macular edema, is what makes your central vision, the vision you need for reading or seeing faces, go a bit fuzzy. The thing about RVO is that it rarely happens out of the blue. It actually shares risk factors with other health conditions, especially things that affect your circulation. High blood pressure, for example, can make the walls of those tiny eye veins weaker over time, making a blockage more likely. It's a really powerful reminder of just how connected your overall health is to your eye health. Okay, let's get to the most important part, what we can do about it. And here's the good news. There are fantastic, proven treatments that can get you started on the path to recovery right away. So the main goal here, the number one mission, is to tackle that swelling, that macular edema. If we can reduce that fluid buildup, we can help the retina start working properly again and get your central vision clearer. And today's treatments are incredibly good at doing exactly that. Now, the main treatment involves a quick injection of medicine into the eye. I know, that sounds pretty intimidating, but let's walk through it, because it's so much simpler than it sounds. First, they give you really strong numbing drops so you feel comfortable. Then they clean the area to keep everything sterile. The injection itself, it's over in a split second. It's a super precise, very routine procedure that's designed to be quick and easy. So, is timing a big deal? Absolutely. This quote here says it all. Study after study shows that the sooner you start treatment for that swelling, the better your vision will be in the long run. Seriously, starting your treatment on time and sticking with it is the single most powerful thing you can do for your sight. All right, so treatment isn't a one and done kind of thing. It's more of a journey. This next part is all about working with your clinical team to check on your progress and keep your vision heading in the right direction. So what does that journey usually look like? Well, at the beginning, you can probably expect to come in about once a month. This lets your doctor keep a close eye on things and make sure the treatment is working well. Then, as your eye gets more stable, those visits will likely get more spread out. This regular monitoring is absolutely key. It lets your team tailor the plan just for you. And get this, here's some really encouraging news. For about a third of people, just those first 3 injections are enough to get them to the best vision they can possibly get. Now, a lot of people do need treatment for longer, but it just goes to show that a really fantastic result can happen right from the get-go. If there's one thing to take away from all this, it's that consistency is everything. That medicine in the injection has a job to do, but it only lasts for so long. Sticking to your appointment schedule is what keeps that medicine working, keeps the swelling down, and protects your vision. It's the absolute number one factor for success. Now, your clinical team is going to be there every step of the way, but honestly, you are the most important person on this team. There are some really practical things you can do every single day to help your recovery along. So what can you do? Well, a few really important things. Just keeping an eye on your vision at home and letting your doctor know if you notice changes is a huge help. And working with your family doctor to manage your blood pressure or blood sugar, that's tackling the root causes. It's not just good for your eyes, it's great for your whole body. And this whole process is about more than just what happens in the clinic. It's also about making sure you have the tools you need to live your life exactly how you want to, starting right now.
See that bit about early stage? That's so important. A lot of folks have this idea that vision support is something you look into way down the road, but it's totally the opposite. Getting this kind of help early on can introduce you to simple tricks and tools that make a huge difference while your treatment is getting started. So, what does this support actually look like? It's all super practical stuff. A specialist could show you how a different kind of light bulb can make reading easier, or introduce you to a magnifier that makes things pop. They can even help you find clever ways to organize your home to make things safer and easier. It's all about finding smart, simple solutions so you can keep on doing all the things you love. Phew, we have covered a lot today, from what RVO is, to how it's treated, to all the support that's out there for you. This journey all starts with understanding, but it really moves forward with conversation. So as we finish up, just think about this. What's the one biggest question on your mind that you're going to ask your doctor at your next appointment? Thanks so much for tuning in.